So welcome to High Country Doula's webinar today on cesarean birth. What, why, and how. We're going to really kind of dive into helping you understand as an expectant parent what is cesarean birth, what that looks like, and if you may end up having a belly birth, we want you to feel fully prepared for that journey, know how to navigate through that, and know how to get those supportive resources during that time. So welcome everyone. If we haven't already met, my name is Allison Rollins. I am the owner of High Country Doulas. I'm a doula, a childbirth educator, a placenta encapsulator, and a infant feeding specialist. I also support parents in the postpartum as a positive parenting practitioner. So I really love helping support parents navigate through that time of pregnancy and fourth trimester and beyond. It's so important. We want you to feel fully supported. So I'm ready to get started with this. I hope you are excited to learn more about cesarean birth. All right. So let's think about just that understanding of where you start out. Many expectant parents really envision that the birth of their baby, those images that come to mind are really varied from individual to individual. So some imagine an unmedicated vaginal birth. Others may envision navigating through birth with an epidural to support them with their pain. Others may decide that a cesarean is right for them. So today we're just going to take a look at what is cesarean birth, why cesarean birth might be done, and kind of what to expect when your baby is born via cesarean, not only for you, but also for your baby. So what is cesarean birth? The term cesarean birth is thought to be named after Julius Caesar. It is a word that was coined after Caesar was born that way, but there are some that debate that that is incorrect. So regardless, it is how it's named. The name has stuck. And it is really a process of delivering baby through an incision in the birthing parent's abdominal. The cesarean birth is abdominal surgery and is commonly referred to as C-section or cesarean delivery, sometimes belly birth. Once baby has been delivered through the abdomen, the uterus and the abdominal wall are closed using sutures or staples. Really, we'll talk more about the differences between those. They can vary from doctor to doctor. But we're just going to take a look at the common reasons why cesarean birth may be necessary. So we look at kind of different routes: medically indicated or patient choice. Cesarean births just really can happen for a number of reasons. Really thinking about navigating through the medical indicated, it could happen before labor happens due to medical reasons, or during labor. Those are kind of the two different things that can happen there. All right, and then consumer choice. This can sometimes happen for parents who may have other conditions where they may feel more their mental health is at stake to have a vaginal versus having a cesarean. Awesome. So let's talk about some of those medical reasons why a provider may suggest to have your baby born via cesarean. So a couple of those things are, probably you already know. Some of you may not know. I think it's helpful to know that most of these things that we're going to talk about today are the more common reasons. There are less common reasons, medical reasons that might come up that are not talked about in this webinar that could happen to you. Those would be more rare, but we're just going to talk about the common ones. I just want you to be understanding that. So the first one is our, of course, multiple gestation. So having either 2 or more babies can sometimes mean that cesarean birth is recommended. A lot of you probably already have heard about friends who may have had twins via cesarean. You may also know people who have had twins vaginally. So both scenarios could be possible. It doesn't mean that you will automatically have a cesarean if you have a multiple pregnancy. Other reasons are herpes. So if a birthing person has an outbreak of herpes that could somehow impact baby, the safest route is to have baby being born cesarean. Also maternal HIV. So if a mom has an active HIV, then it's best for baby to be born via cesarean in many cases. So severe hypertension or preeclampsia. For most individuals, a mild or moderate preeclampsia or high blood pressure due to pregnancy is not necessarily a reason for cesarean birth. An induction of labor and vaginal delivery are the preferable options for that. However, those with severe preeclampsia, cesarean birth may be the best course of action. And according to American College of Obstetrician and gynecologist, I can't talk today, severe preeclampsia is defined as your blood pressure being 120/110 or greater on 2 occasions, 4 hours apart while resting. Pulmonary edema or excessive fluid developing in the lungs, severe upright abdominal pain, sometimes vision or cerebral disturbances, kidney and liver enzymes elevated, and low platelets. So in those conditions, oftentimes cesarean is the best. But I've had many moms who have had preeclampsia on the mild or moderate and been able to give birth vaginally. So that'll be something that you can walk through with your provider. And there are lots of things to do to improve your risk of getting high blood pressure, and some things you can do to manage that as well. So if you have that, that's something that you can talk to your providers and your doulas about. One of the things important to know about the decisions, sometimes the gestational age of baby and the severity of symptoms are also really important in that aspects of trying to decide what's best for mom and baby. And really the only cure for preeclampsia is delivery of the baby and the placenta. So fetal position, I'm sure you ladies already know. You've heard lots of people talk about fetal position as a reason why providers may suggest to have a cesarean. So there's lots of things that can be done to help encourage baby's movement. However, it is not a definite. So if baby is not in a head down position, they are in a breech, which is feet first or bottom first, or what we call a transverse lie, which is they're kind of laying sideways with one head on your one hip and your feet on the other. Those can be dangerous to deliver. Most providers don't have familiarity with delivering breech, and they don't have training or experience with that. So cesarean birth is the most recommended. If you want to have your baby delivered breech, then seeking out a provider who does have experience delivering breech is your best option. You can also work with your provider to possibly manually manually change the position of baby using external cephalic version, which is a procedure where your provider will turn baby in a position using ultrasound guided to get baby head down. When that happens, if it's successful, Sometimes they will suggest to be induced so that baby does not then switch back to another position. It is one of those things that you'll talk with your provider about. And there's also lots of other great ways to get baby to turn as well that have been very successful, such as chiropractic um, care, acupuncture, and positioning. So lots of other options there if you ever get in that position where you really want to have your vaginal birth. Lots of things that can be done. All right. Another reason that we see parents and providers choosing to have a cesarean is that they may have had a previous cesarean. So, because you've had a cesarean before, doesn't mean that you have to have another cesarean. And it is now recommended for most birthing people to try for a vaginal birth after cesarean because they do know that it's healthier for mom and baby in most cases. So it's something that you can talk with your provider about. American College of Obstetrics and Gynecologists do recommend to try for what we call a Vbac, which is a trial of labor after cesarean, or TOLAC, which is a trial of labor after cesarean for a vaginal birth after cesarean. Something that it's not once a cesarean, always a cesarean anymore. Other reasons that could come up for parents is placenta previa. And this is a condition where your placenta is embedded in the lower portion of your uterus near the outlet of the cervix. So when we think about that neck of the cervix, which is the opening of the uterus where baby comes out, the placenta needs to be I think it's 2 centimeters away from the cervix to have a safe vaginal delivery. Many times, and I've had many moms who this has happened to, early on in pregnancy, their provider tells them that they may have to have a cesarean due to placenta previa. But the body is so intelligent, it really knows what to do. And often the placenta will grow away from the cervix, making it safe for a vaginal delivery. It's happened multiple times. So you definitely don't have to make that decision until you get closer to in that third trimester, where some parents will still have what we call complete placenta previa or placenta previa that is just not moved during the second trimester. Providers will check this using ultrasound. So they may have to do vaginal ultrasounds as well to really make sure that they're knowing exactly where that placenta is lying for a safe delivery. And this does occur in about 1 in 200 pregnancies, but many of those do move out of the way for vaginal delivery. We do know that it is not safe to have a vaginal delivery if the placenta is lying too close or covering the cervix. All right. So for some individuals, the decision to give birth via cesarean may not be made until labor is underway. So we basically call these sort of an unplanned or unscheduled medically indicated cesareans. So we're going to take a look at the most common reasons that the cesareans may become necessary once labor has begun. So during labor, your provider is really monitoring the vitals of you and baby. These vitals are indicated on how vital signs are an indicator on how each of you are doing in handling the stress of labor. And so as labor progresses, there may be signs that the provider sees that could indicate it necessary to have baby via cesarean. So fetal distress is probably one of the most common of these. ACOG really identifies fetal distress as what they call non-reassuring heart tones. And this is This is something that can happen for a number of reasons. So we'll talk about some of the reasons that baby could have some non-reassuring heart tones. Your provider is going to be monitoring this. You will be monitored full time if you have any medicine or you're being induced using medicine. They will be monitoring these. And there are some reasons why baby's heart rate could kind of not be doing, showing really good reassuring tones during your birth. Some of those are the breaking of the bag of waters. So your baby is cushioned by this wonderful bag of waters. And for some of us, our bag of waters may break. About 10 to 15% of parents' labors start with the bag of waters breaking, and then the contractions come. But for some, your bag of water stays intact until later in labor. And that breaking of bag of waters does mean that the uterus is clamping down directly on baby versus having sort of this water cushion that protects baby a little bit. And sometimes baby can have a cord that is near. And so when the contractions are happening, I don't see this happening a whole bunch if the bag of waters breaks later in labor. A lot of times bag of waters will remain intact for much of early labor and into active labor and protecting baby from those contractions. We know that the use of Pitocin to induce or to augment or speed up labor can bring on really powerful contractions. And these can be a little bit more intense than your natural contractions would have been. And so those contractions can sometimes cause those non-reassuring heart tones. Oftentimes we can remove or pull back from the Pitocin and see those heart tones go back to normal. So there's lots of things that we can do to change that, but it can be a reason. Epidural. So epidurals can lower mom's blood pressure. If mom's blood pressure drops, then baby's blood pressure can drop. So they do a lot of things to ensure that that doesn't happen, but in some cases it still can. And really what we're looking at is the interventions that are applied during labor can interrupt what we want to see, which is good oxygen flow to baby, blood pressure maintaining, and a good heart rate. And if any of those are off, then we may see some signs of baby's distress. Other possible scenarios that are less likely are maternal illness, infection in the baby, umbilical cord compression, placenta abruption, or maternal positioning. So as a doula, if I'm working with a mom and see some fetal distress or fetal heart tones, I'm going to reposition her because likely it is that baby is kind of pressing on one of the cords, causing some distress. So we just move mom a little bit and then that changes. And you see good, nice heart tones again. So sometimes position is really key to this, and that can be changed regardless of if you have an epidural or not. Other things that your provider might do in this case to avoid a cesarean or just to monitor any distress in baby would be applying oxygen. So oxygen can be applied to help with those fetal non-reassuring heart tones. Also IV fluids, or what's called an amnio infusion. I've seen this done a couple of times, and basically what providers are doing are pumping some saline solution up into the uterus to help with any of those cord compressions or that clamping down of the uterus on baby to help offset some of those. So there are lots of things that your providers will do in situations to offset that, because they want you to, they're trying for happy, healthy babies and moms. One of the other ones is umbilical cord prolapse. This is a very rare happening. I know one mom who has had this happen, and it does mean an automatic cesarean. And a prolapse just means that when the bag of waters breaks during labor, sometimes the umbilical cord will come down in front of baby's head. This is pretty rare, but it can happen. So when that happens, baby and mom need to be taken to the OR for a cesarean birth. And like I said, again, it is a very rare thing. So most women are never going to experience this. All right. The next thing is uterine rupture. So uterine rupture is basically a tear in the uterus during labor. The uterus is an organ muscle that holds the baby, the amniotic sac and the placenta. And according to the National Institutes of Health, about 1 in 10,000 to 15,000 women are at risk for this for their first pregnancy. That risk goes up a little bit to 1 in 5,000 if you have had a previous cesarean, but it's still fairly low. It is common. Let's see, it's not common. It can be more common for women who have had a previous history of cesarean. This is often something that is identified by mom. It is combined with fetal distress and maternal pain. This pain is the type of pain that is really like something that can push past an epidural. So even women who have an epidural can feel this tremendous pain when it happens. And so it can be intense for women, but when you're in the hospital, they are monitoring you. I do always tell women, in any sense, you are going to know if things are good or they're not before anybody else, because you know your body. So oftentimes when you feel something or when you have a concern, it's really important that you mention that to your nurses, your doulas, your providers, so that they can then assess it. I say that moms know oftentimes way before those monitors can check anything if things are not right. So listen to your intuition on that. So preeclampsia is one of the biggest reasons that can cause maternal distress during labor. And during an induction, sometimes your symptoms of preeclampsia can worsen. So that high blood pressure and protein in your urine can sometimes just make it too much for mom. And so a cesarean is recommended for that. All right, so some expecting individuals just prefer to have and choose a cesarean. This is called consumer choice. So there are two main reasons why an individual, they include preference for a cesarean with the first birth or for a cesarean after they've already had a cesarean. So a couple of different reasons there. And that can often be something, let me fast forward here. Something that is personal for that individual. So while birth may seem like a totally natural bodily function for some of us, we're like, yep, my body can do this. I'm awesome. I'm ready for it. Others, it may be a big sense of fear or anxiety. And they may have a previous history that might lead them to that choice. So we always want to understand that every woman makes a choice based on her own decisions. We know that some individuals may have trauma that might be a reason that they choose cesarean birth. So it is important to know that you have a choice. All right. So how do we cope and support when we have a belly birth? I think one of the biggest things that I think is really important is to think about your birthing team and to be preparing yourself for what it looks like if you have the birth that you want, or mostly the birth that you want. If that that path goes differently and it leads towards cesarean birth, understanding what to expect with it is really going to be reassuring for both you and partner. So I really think that can be super helpful for partners to understand the differences. A lot of women will have moments of sort of grieving at the loss of vaginal birth. And sometimes that can not be allowed in the situation because everybody says healthy baby, healthy mama. And I think, all of us want that. But when we state it without listening to a woman's emotional grieving of the loss of her birth, we are not really serving her. So I think it is important. And I really talk to partners about this during childbirth ed, how it's important to listen and give her a moment, because I really think that most all of the cesarean births that I have been a part of are either planned or they are suggested during the labor, but very few of these, besides the cord prolapse, would be something that we couldn't have time to process and talk about it. So I love this picture because it's one of those things where a lot of this is a conversation. So we're walking through this. The next steps would be my suggestion as if a provider is talking to you, to kind of say our next step would be this, and this is what that looks like. And this is that time where you ask questions, you help yourself get prepared mentally for that next step. It's really key. So I just love this little picture where it's really important to feel heard and listened to. And one of the things that I think is really important is that your birth is sort of this central piece of what we would look at as all of the collaboration of your birth team that is surrounding you. So that physical support, that emotional support, information and advocacy are key to help you and your partner, right? Your partner be able to support, because if partners don't feel confident, then they can't support you. The progress of your labor, how does that go? And then the memories, the birth memories. So thinking about putting all of these things together helps us to have better outcomes. And one of the things that I think for me as a doula are so important is for women to understand how doulas are there to support the process of birth. Doulas are there to provide prenatal education, labor and birth support, and then that postpartum support after baby arrives in the hospital or after in your home, to help you with those transitions and those changes. We can be beneficial both in vaginal birth and in cesarean birth to support mom and partners and to help things go as smoothly as possible. We're there to help you understand and inform you of your choices, to help you process emotions, there to help you physically make sure that if it's in vaginal birth that we're supporting you with the sensations of the contractions, or physical, maybe with massage, or physical with maybe you need to rest right now and that's what your physical body needs. So, and with the cesarean birth, we would be there to support that physical recovery, helping you to learn exactly how to change the movements of your body or how to adjust feeding the baby with cesarean versus that vaginal birth, and just those changes, and also how the medications might affect you. We want partners to know and understand that so that they can best help you as well. One thing to know, we are not medical. Doulas are non-medical. So we work with your nurses and with your providers to make you feel fully supported. Studies have shown that the most effective tool to improve labor and delivery outcomes is the presence of a continuous support person. And if that person is trained, the outcomes are even better. So a lot of that is really important to your overall experience and the health of you and your baby. All right, we're going to switch gears here and talk really about how is a cesarean birth performed. So understanding how cesarean birth performed, this is sort of an average overlook of how cesarean birth is performed. And then each doctor may do that a little bit differently depending on their training. So when a cesarean birth is indicated, the timing of your cesarean and your individual health factors will determine what type of anesthesia can be used. Like I said, in true medical emergencies, which are very rare, women will be put under general anesthesia. That means they will be put under. In this situation, partners are not allowed in the OR. This is, however, rare. So most situations, if you have a epidural already, anesthesiologist or nurse anesthetist will then increase the medication in your epidural to prepare you for a cesarean birth. Or they will place what's called a spinal, which is very similar but a different cocktail of drugs, which are placed while you're in the OR. So, right. Make sure I'm getting all these things in. Another important step of this is IV fluids. So of course, if you already have an epidural, you already have IV fluids. If you don't, then an IV will be attached into your arm and given you delivery of fluids and to be able to give you the medications through your IV as well. So before the cesarean birth, during the cesarean birth, and after, most of your medications will be given via IV. There's also a bladder catheter that is placed to empty your bladder to make sure that your bladder doesn't become overly full. And it will stay in place typically for the first 24 hours, and then it will be removed. An antacid medication will also be given to neutralize stomach acids and to, before the surgery. Typically also the surgical area is prepped and shaved where the incision is placed. So a nurse will do that typically in your room before you go back. Sometimes it takes place elsewhere. Once you enter the operating room, you will have a drape or screen that is placed across your chest, and they'll position you to the table. And then some hospitals will have clear drapes, so you can ask for that if it matters to you. You're going to get a really good scrub, clean everything down. We don't want any germs there, so they'll give you a big scrub. They'll also be sure the anesthesiologist will be sure and ask and monitor if you can feel things. So they may put some pressure on some areas to make sure that you're fully numb, and then you'll have to let them know what you're feeling. So after all of that's done, then they will begin the procedure. They make an incision. It's made just above the pubic bone through the skin, and it's approximately somewhere between 4 and 6 inches. Rarely do they need to make a vertical incision. There are cases where they may have to do that depending on baby's position, or if it is twins or something like that. So they will separate everything out as they go through the layers, the abdominal muscles, and make an incision in the uterus. And the incision is mostly horizontal, again, but sometimes they have to make a T incision. Once the uterus is open, then the bag of waters will be open if it's not already broken. So even if it's not, even if it is broken, sometimes it's broken down at a different place. So they'll make an incision through the amniotic sac, and then it's time for baby to be born. So then baby comes up and out, typically head first. So they make sure babies get in the right way to come up. There's a really cool video that I saw recently of a baby being sort of assisted by mom with she pushed her cesarean birth out. It was just the most amazing thing. And you could see the baby being releasing the fluids in their nose and mouth as she was pushing her baby out via cesarean. So there's lots of things that we're still looking at as far as the health of baby and health of mom. That is not currently how most cesarean births are done, but it's really something to see like, oh, that's so neat. It's just similar to the way baby's born vaginally, pushed out by mom. All right, let's see. So after baby comes out, which this typically takes like sometimes 5 to 10 minutes at the most. It's very fast. This is the baby comes out. Oftentimes you'll hear baby cry. Oftentimes providers will lift baby up and say, you know, here she is. Sometimes they'll drop the drapes and they'll say, here she is. If you've got the clear drapes, you're going to be able to see her. So I'll just show you this real picture. This is a picture of clear drapes. You are on your back, so you're really looking up. And I really think that it's lots of things that I talk to dads about and partners about the importance of supporting mom in the OR. There's so many little tips that can be so helpful to help you emotionally to enjoy this birth as much as possible and to feel calm and a part of it as this is your birth. And so it's really neat. And I think that, you know, in general, hospitals and providers and nurses want you to be as much a part of your birth process, even in the OR. They just have some policies that are sort of somewhat outdated in most cases that they're kind of shifting and transitioning. But some things that you can do is having clear drapes can help you feel a part of it. Some providers are even dropping the drapes and helping parents be a part of that. Um, as doulas, we're there to support partners. Sometimes birth photography is important in this. So even if it's your camera, having out a camera so a nurse or a doula or somebody can take photos or mini videos where mom can have these memories, because sometimes having medication can impact our memory. And I think especially if mom's been in labor for a long time and she's really exhausted, we want her to feel very um, like she can remember pieces and parts of her labor. I would say, as a doula who's supported many women, that even in regular birth, we have sort of these snippets of images of our birth, and sometimes we can't remember every piece of it. But it can be really helpful to have those pictures to really help us remember those. Other things that can be really helpful is not restraining arms down. So asking, that might be something that you put in your birth plan, asking to have your arms um, not held down. Um, Also, uh, not having as much sedation drugs, so just the numbing part, but not as much like sedation, so that you're more clear-headed. Immediate skin to skin. So this is some things that we know are really important and recommended by American Academy of Pediatrics for birth. So it's starting to transition into the OR as well. Music of your choice. So you can have any kind of music played, and that can be something that you have total control over. Let's see, I'm going to flower this too. So skin to skin, you can see this is after birth in the recovery, and this is skin to skin in the OR. And you know, baby is kind of somewhat underneath the drapes, but I think it is totally okay in most incidents, because even though your baby is born via cesarean doesn't mean that there's anything wrong with baby. They're going to check out baby a little bit more closely for a cesarean birth. They can have a little bit more liquidy and just have swallowed more things because they don't get that compression that you would in a vaginal birth. So they're going to be a little bit more mindful of respiration and those things. But they are, you still are able to have skin to skin for most cesarean births. So another thing is breastfeeding in the OR. So breastfeeding can also happen in the OR, and this is not a common thing yet in the areas that we work in, but I definitely know that it is possible to do this. For most babies are healthy and moms can be ready to do that. Um, so something to consider in knowing what your options are. A lot of times babies are whisk-offed and taken to the nursery. This is a common practice in a lot of hospitals, but babies can stay in with you in the OR in many instances. This is something that you do have to ask for. And baby does have to be doing well and having really good breast signs and all of those things. But definitely ask for this if it's something that interests you. Sometimes this helps you to settle and feel much better. It helps baby as well. It's better for baby to stay with mom, and they can finish up the repairs while you are snuggling and spending time with your baby. If you can't have this, then dad can go with baby to the nursery. I've done this a lot where I step in as dad goes out with baby. So you have that support person still with you as you're going through this process. All right. Let's look at meeting your baby. So we talked about once your baby is born, the umbilical cord will be clamped. You can ask for this to be delayed. I have seen it happen in some ORs. I know it's definitely a practice for vaginal births in most of the hospitals that we work in. And baby is typically taken over to the warmer, which is usually somewhere nearby. That warmer, there is a baby nurse, a respiratory therapist, and typically one more nurse. And they just check baby out typically to make sure baby is breathing well and monitoring their vitals. And then when baby is stable, then they will bring baby back over to you, typically swaddled. You can unswaddle baby and have baby skin to skin and lay them on you. So this is something that is not typically done. Again, this is something that you would have to ask for. You could put this in your birth plan under cesarean parts if that is really important to you. Also, some parents who don't feel comfortable holding baby, they may want dad to hold baby, and dad can also do skin to skin. So it's another possibility as far as choices that you might have. So when you're meeting your baby, your provider is taking care of you. They're monitoring your bleeding. They are going back and placing everything back together for you. They are stitching up the layers. So the uterus and all of the layers that they have. Sometimes there will be use of staples instead of sutures. So if this is something, especially if you know you're going to have a cesarean birth, you may want to ask your providers about what are their typical procedures for cesarean birth as far as the repairs. This is something that you can have a choice over if you prefer one over the other. But the whole process of that typically takes about 30 to 45 minutes versus the 5 to 10 minutes of baby being born. And then once everything's back together, then you're going to get settled in back into typically a recovery room with your baby. Sometimes that is back into the same room that you left. Other hospitals, it's going to be a different room, more of a postpartum recovery room. So once you're back there, if you haven't had a chance to get with baby, you and baby are going to get reunited. You'll still have lots of things happening. So, you're in post-op at this point. You are going to have a pulse ox monitor. You're still going to have your IV. You're going to have leads for your heart. You're going to have your blood pressure cuffed, lots of things being monitored. So your nurse will be monitoring your vitals every 10 to 15 minutes after you come in that hour that you're in recovery. And then she'll start to do this, stretch those out a little bit. Some of the side effects that women see during this time are things like nausea and shaking. Okay. Sometimes clarity, brain clarity, just because of the drugs that you've had. So if you're feeling any of these, just have a conversation with your nurse and let her know. She can reassure you what's normal and what she might need to address with either medication or checking in with monitoring. She's also going to be monitoring your uterus return. So she may do some uterine massage as well to make sure your uterus is clamping down. She'll be helping with the bleeding. Even though you have a cesarean birth, you're still going to have that postpartum bleeding. It's just going to be, typically, it would be a little less than it would if you had a vaginal delivery. So in this time, it's really helpful to have an extra set of hands. As a doula, I'm in there helping you to learn how to breastfeed, laying down, because you are laying down. I am reassuring dad, showing dad how to hold and swaddle baby, or do things like that as your nurse is monitoring your vitals. So typically babies, if they're born vaginally, are going to probably show signs of feeding in 15 to 20 minutes of after delivery, sometimes earlier, sometimes later. With a cesarean birth, by the time you get back and it's 45 minutes to an hour, they're going to be more likely to be hungry. So it's a great opportunity to be able to get started. And we help you to navigate through all of those cords and help you feel more comfortable and confident in getting baby having that first feeding. It's um, so important. And we also get to show dads how to help with that, which is really amazing. So in that first hours, day to 2 days, what can you expect as far as how you're feeling and your recovery? So how long till baby gets back in the room with you? If baby's taken away, it's typically around 45 minutes to an hour. Sometimes it can be longer. In some situations. How long do you get your feelings back in your legs? It can take anywhere from an hour or two to several hours to start getting your feeling back in your legs. And this depends on the strength and the dosage of the medications used and your response to them. So if they dose you pretty strong, it may take longer for that to happen. A lot of women feel very fatigued and exhausted. So if you've been through labor and then you go to cesarean, you just need to just rest. Rest is the most important thing. But just know that that can be normal. And then sitting up, it takes a couple hours till you feel like you can kind of start to sit up. So laying down is really how you're going to be, and you can learn how to breastfeed in that position really easily. Typically, the providers and nurses are going to encourage you to start getting up and walking and moving around somewhere by 12 hours post birth. So you can expect that. It's really healthy to help your body systems to be able to start moving. That will help with your recovery for sure. And you will also have pumps. So let me show you the pumps, the post-op. If you've ever been in post-op or surgery, you're going to have some pumpers on your legs to help with any blood clots, which can happen in any surgery. You will also have your catheter still in for typically another day after birth. So that'll be normal. And then let's see, you will also sometimes just sit up rather than getting up and walking around. So everybody's different as far as that goes. It is important to have support when you do get up. So you never want to do that alone. You always want to have a nurse in the room with you so that they can help you with that and make sure that you do it gently and it not affect your suturings. So typically moms are very hungry postpartum, regardless of vaginal or cesarean birth. Definitely with a cesarean birth, you do want to go slow with your what you're eating. So commonly, like, just start out with like crackers and peanut butter, something very mild and bland, and don't go too fast. Stretch it out. That will help with any types of stomach upset or nausea. I've had moms who get so hungry and then they end up throwing up, and it's just the worst thing in the world. Sometimes women can have a headache. You need to let your provider know if you feel like you're having a headache. Um, so just give yourself a lot of grace. You're going to have to go slow. It takes a while to get all the sensations back and to feel. It's a very vulnerable kind of feeling, but just know it'll pass. It will pass. You will have pain medications that are provided to you. Some of those may be IV. Some of them later on may be oral medications, typically like an ibuprofen acetaminophen combination, and then sometimes opioids are given as well. Those can be constipating to the body, so you may it may be recommended that you have a stool softener, because you do not want to have that first bowel movement be painful. We want it to go well. Itching is also a common thing. Typically, the medications can cause post-op itching, and so if you're suffering from that, it is really important to have lots of support, because it's a horrible feeling to have that itching, sometimes shaking as well. All right. So a couple of things to note that I think are really important. We want to make sure that all your healing from your cesarean birth is going smoothly. And things that you need to know really are, if I have a fever, if you're in the hospital, they're going to be monitoring your temperature. But after you come home, if you have a fever higher than 104, 100.4, heavy vaginal bleeding that is big golf ball sized clots, bigger than a golf ball, unusual odor or discharge, unbearable pain, headaches or dizziness. If you're having feelings of just really depressive feelings, woefulness, just not feeling yourself, you need to let your providers know. Also, any redness or swelling from the incision site. So if you see anything, or maybe your partner notices it, definitely something that you want to call your doctor about. Any chest pains or difficulty breathing, those are really important things that you want to call your doctor about. Pain with urination, or swelling and pain in your legs. Those would all be things that we would want you to definitely talk to or call your provider and let them know. So after surgery, in general, you can expect to stay in the hospital for anywhere from 3 minimum to 5 days. And depending on how you and baby are doing, you're going to be encouraged to get up and walk. Like I said, the walking is going to help with abdominal gas. So all of that trapped gas that's in your abdomen, this also serves to help prevent blood clots. You do not want to drink from straws after your cesarean. So you want to take sips. That can increase your gas in your abdomen area. And really, those first couple of weeks postpartum for cesarean are the hardest. During this time, it is best to take it easy and not to lift anything heavier than your baby. If you live in a house with one or more levels, definitely setting up a station where you can be in one floor is best if possible. And you may also have some hair and skin changes, breast swelling, sensitivity, fatigue, after pains. Those are all normal postpartum for moms. You will have a 1 to 2 week follow-up visit, and then a 6-week follow-up visit with your OB. You could have more than that, but that's typically minimum. And you typically are unable to drive for 4 to 5 weeks, sometimes 6 weeks. So just a couple of things I want you to kind of feel like you're prepared for. You want to make sure that you stay on top of your pain. A lot of women that I work with are like, I don't really want to take drugs. I want to stop taking the drugs. You do want to kind of balance that. You want to be able to enjoy your baby and be able to focus on that, just bonding with your baby. So if your pain is interrupting your ability to connect and bond with your baby and enjoy, then you know that it is too much. So just a real good balance, and you'll figure out what that is, because everybody's pain tolerances are different, and everybody's response can be totally different. So talk to your provider about that if you have any questions. With your incision site, it is important to keep that clean and dry. If it's stitches, those will typically dissolve and fall off. So just follow whatever your provider's post-op instructions are. It can definitely take up to 6 weeks to feel semi-recovered. And most women feel the effects of having a baby up to a year with vaginal or belly birth. Just remember, it's okay to ask for help. This is your time of receiving. This is not a time for you to be doing or giving. You'll have time for that later. You will be reciprocating that to other people. So having a postpartum doula can be a super helpful. Postpartum doulas are there, they know kind of what it feels like to be in that recovery time. They know what you need for the most part, and they're there to listen, so that they're really not there with any of their own recommendations or agendas, but they offer lots of information, so they can really help you get the most rest. They can ensure that your recovery is as fast as possible, and they can help you to know how to connect and to learn your baby's cues, help you with feeding, lots of different things like that. So it is super helpful for parents. We can also help with dads and helping them with that learning curve of parenting. So this is a picture sort of the incision site after. So everybody's is kind of different, but it can be tender. You definitely want to monitor that and make sure that it's healing well and that there's no oozing or redness in the area. Another thing can be helpful is to hold a pillow or pressure there. Most women want to grab their incision site to kind of support it. So if you cough or laugh or sneeze, or even sitting up, sometimes it feels really good to put a pillow over that to support that area. Just wanted to mention that. Awesome. So we're getting to the end. We have lots of wonderful sources for bringing this webinar to you today. I will send those to you via email when I send you the recorded copy. So if you're watching this as a recording, again, High Country Doulas is here to support you in all of your needs for your pregnancy, postpartum, and beyond. We love helping support parents through cesarean birth and vaginal birth, and helping them in home when they bring baby home. So check us out at online, or you can give us an email call at our email at info@highcountrydoulas.com, or you can call us at 828-278-8949. Thanks so much for joining us, and I look forward to supporting you if you need any support, and best wishes for your birth.